Hello, everyone. Good afternoon. Thank you so much for joining us today for our live stream on winter heart health and diabetes, staying safe in cold weather. I'm Kayla Bowen, Digital Marketing Specialist for Byram Healthcare, and I'm joined by Tavia Vital, a certified diabetes care and education specialist with years of experience helping people with diabetes manage their health. Tavia, can you help me, because I feel like I might have just mispronounced your last name?
Actually, so in English, if you're going for English, Tavia Vital. But
Okay.
if you speak Spanish, then you can call me Tavia because that's
Okay,
fine too.
cool.
Yeah,
Cool. I meant to review that right before. Um,
that is
Byram
okay.
Healthcare has been a national leader in patient direct medical supply delivery for over 50 years, rated the best overall diabetes supply company by Verywell Health for 4 years in a row with an A+ rating with the Better Business Bureau. We are your trusted partner in diabetes management. At Byram, we know that life takes care, and today's conversation is one way we are fulfilling that purpose. Before we begin, please note that nothing stated today is intended to be a substitute for professional medical advice, diagnosis, or treatment. Our discussion is for informational purposes only. Always seek advice from your healthcare provider for any specific medical conditions. So, Tavia, do you want to give a short introduction of yourself for our viewers?
Sure. So again, I'm Tavia Vital. I'm a registered nurse and a certified diabetes educator, otherwise known as a certified diabetes care and education specialist nowadays. And I've lived with type 1 diabetes myself for 43 years. I'm going to have to up the count in a couple more months. And I also raised two teenage boys, one of whom also lives with type 1 diabetes. So, in addition to the work I do during the day, I'm surrounded by diabetes all the time. So, that's where I became interested in becoming a diabetes educator, of course. So, I work with integrated diabetes services, providing one on one individualized care for primarily people who take insulin for their diabetes, and work with young kids and their parents on up through the lifespan.
Awesome. Thank you so much. And Tavia, again, I apologize for the mispronunciation before. In full disclosure, I have had a migraine today, so I'm a little
Oh,
discombobulated.
I was debating on whether to take a migraine pill or not, so I hear you and feel you loud and
Wow.
clear. The fog is no good. You've
Yep.
got to weigh your pros and cons, and there is no right answer, right? Cool.
Right, definitely. Yep. But I'm still happy to be here, of course.
That's good.
Okay, so today we're going to talk about cold weather's impact on, let's start with blood sugar and circulation. So, Tavia, if you could talk a little bit about how cold temperatures affect the body in general, and then maybe how that ties into diabetes.
Sure. If you think about what you do, what you notice your symptoms are when it's cold, you like close in, right? Try to cover up and close in to protect yourself because it doesn't feel that good when things are cold. Your body does a similar response. Your blood vessels will actually shrink and kind of tighten up in response to the cold. Just naturally, that's what your body will do. And so, if blood vessels are constricting, that can raise blood pressure. So, that's something to consider for safety. If you already live with high blood pressure, what are some things you can do to prevent some of that over constricting of blood vessels? Can you, for example, wear enough layers? Can you go out with gloves on and a hat on your head so that you aren't causing your body to over constrict and potentially pushing those blood pressures up? And then the other thing that happens is your body is going to need more energy to burn fuel to keep your temperature regulated. So if it's extremely cold, one of two things can happen to blood sugars related to the cold. One, if your body is all stressed out from the cold, you may see your glucose pop up high. And that might be a surprise because you were fine, you go out in the cold, now it's high. If your body is just not seeing it as overly stressful, it's just compensating for that stress and it's burning a lot of fuel to keep your core temperature warm, you may actually see a decline or a lowering of your blood sugars. So it does pose some risks related to heart health and blood sugar for people living with diabetes. Absolutely.
Right. How about when, because especially these days, I feel like the temperature is so unpredictable. Is there
Yeah.
anything like specific regarding just like a quick change from a warmer weather to cold weather from one day to the next?
Yeah, and I think that's interesting to think about because this is one that it sort of ties into things that maybe your mom or your grandmother might have told you when you were young, like don't go outside with wet hair after a hot shower, right? It's so thinking about what we just talked about with how the blood vessels respond to changes in temperature, it's wise to prepare your body if you can and make the change from temperature statuses more dramatic, less dramatic, more of a transition versus a shock. And that can go both ways. So, for example, to prevent getting cold, if you dress in layers, you wear maybe something that has some support. If you normally, especially, are supposed to wear some support socks, for example, to help circulation stay working effectively, then make sure you're wearing the appropriate clothing items. And then on the opposite end, let's say you're out in the cold for a while and you come in the house. And what sounds like a really great idea is a nice hot shower, right? Who doesn't love a hot shower after being out in the cold? Just a word of caution, though, the opposite happens to blood vessels when they get warmed up. So if they were just super constricted from being cold, and then you hop into a hot shower, they can over vasodilate, and that can cause a big drop in blood pressure, and it actually causes people to pass out. And passing out in the shower is not the best plan if you can avoid it. That's the people's least favorite place to pass out because, you know, if emergency services get called and you're in there with the shower curtain in your hand,
Yeah.
it's just not the plan you want to plan on, right? Yeah. So use caution. And if your hands get cold, you're supposed to let them warm gradually and not just put them in warm water to warm them up quickly. You're supposed to let them air temperature warm or use cold water to change the temperature on them versus what our instincts are is to get everything hot.
Right.
So be careful with that too.
Yeah, that makes sense. So, what is another tip would be maybe to monitor blood sugar more frequently during winter?
Yeah. Yep. Since winter temperatures vary and your activities might vary, like for example, if it's snowing and you're going to go snow shovel, you want to know what your glucose is doing for 30 to 60 minutes before you head to the door to go outside to shovel. And then if you're shoveling for 5 minutes, great. But if you're going to be out there a while, then depending on your kind of diabetes and the medicines that you may take, you would be wise to take breaks specifically to check your blood sugars. And when you're checking your blood sugars, if your fingers are cold, you actually need to come inside and let your hands naturally warm up to about room temperature before you can get an accurate blood glucose measurement. If you're using a CGM device, a continuous glucose monitor device, as long as that part of the skin where the sensor is in the skin has been protected from the cold and it's a relatively normal temperature, then those readings should be as accurate as always.
Right. You know, that made me think about something that I've heard, which is related, but it's not exclusive to people with diabetes, which is you mentioned shoveling. And I've heard before that for folks over a certain age, maybe it's 50 or 60, shoveling snow is actually a moment that can cause like different heart issues with people.
Yes, actually, one of the busiest times in emergency rooms, there are many different busiest times in emergency rooms, but one of them is right during or right after a heavy snowfall, because unfortunately, we get over ambitious and get out there and attack the snow without really thinking about our health because we're focused on the snow and what kind of an inconvenience or problem it's going to cause if we don't move it in a timely fashion. And so you do need to, everyone needs to be careful with snow shoveling because it is, if it's especially wet or heavy snow, or it's just a lot of snow, that is a lot of physical work that is required to remove that snow. And you may not realize it, that you're working as hard as you are because you don't feel hot and sweaty the way you would if you were doing that kind of work when it's 80 or 90 degrees out.
Right.
And a lot of people will go in with a mission in mind. I will clear this driveway before I go back in. Why?
Right.
Because that's easier. You get outside, you get it done, come back in, you're done.
Right.
However, it is often a better plan for safety to do it a little at a time.
Right.
And super annoying. Come in, get rid of your snow clothes again, warm back to room temperature, drink some water so that you're not dehydrated while you're out there, check your blood sugar, and then go back out and do a round or two again.
Right.
Absolutely.
Yeah, that's a good tip. Even though it's not what a lot of people would prefer to do, but it's probably for the best to take breaks. So that makes sense.
It's sort of like if you start an exercise plan, if you're really motivated, it's really easy to do too much, too hard, too quick.
Mm-hmm.
And then you can cause an injury, and then you don't get to return to your new exciting plan for physical activity because you have an injury. And it's super, it's very disheartening when that happens. And knowing that ahead of time can help. You can help plan and make better for your health decisions. This is the same thing. It's the same conversation or same concept.
Yeah.
And really it raises the heart. You mentioned it raises some specific health concerns. So if someone is out snow shoveling and they're doing more than their body is able to handle, it does raise the risk of heart attack or stroke specifically. And there are a lot of factors, but some of which we've already discussed, that vasoconstriction plays a role in disrupting blood flow.
Right. Yeah, when you mentioned the gym, that's a really good comparison there, because I have been in that situation myself. A few years ago, I went so hard going back for the first time in months, and then I could not walk for days.
So, I think most people have done something like that.
Yeah.
Right? Yeah, for sure.
So, how about emergency preparedness for cold weather? What are considerations that people should take when it comes to that?
Sure. The cold weather itself lends itself to certain emergencies that you wouldn't normally have to deal with when the weather is warmer. And that will include things like the power can go out because the power lines could get iced, and then it can knock the power out. And having no power when it's sub-zero temperatures is a little bit unnerving, to say it nicely, right? And also, if you're traveling, if you're going to go see family and friends and you're going to make a long drive, because the winter weather is so unpredictable, just like anyone else, you would need to have an emergency travel kit in your vehicle with you to keep you safe and warm and fed. So some things you might put in your diabetes specific kit would be like some shelf stable snacks, some water. You would want if you can't put your medicines into the kit ready to go, for example, so if your pills that you take for any reason, including diabetes, insulin, glucose meter, test strips, usually people don't have a spare one of all of those things to just put into a kit. I recommend writing yourself a note or typing it out and taping it to the kit, your ready to go emergency kit. So in an instant, you can go grab those things and put them in your kit. So you don't leave without something, or you don't grab, you grab half of what you need and you're missing something inevitably. At least that's what I would do. You might need some batteries. If your items that you use for your diabetes are rechargeable, then it would be wise to have a charger pack. You can get a battery pack ahead of time and charge it up so it's ready to roll. And then it's always good to have a list of emergency contacts, your medical office provider, phone number, and family members that live near or far, just in case. Yeah.
Right. What's the best way to store insulin while traveling in cold weather?
That's a good question. There are different devices that are sold that can keep the insulin at a stable temperature. So if it's insulin that you're using, if you've already warmed up your vehicle, you can just bring it from the house to your vehicle and it can stay with you, as long as you don't leave it in the car unattended with the car turned off.
Right.
If it's new insulin that you haven't used yet and you want to keep it cool, then you would put it into a cooler and do the same thing you would do during the summer, which is put it in a freezer, get a freezer pack, and you can put your insulin wrapped in a washcloth or like a hand towel in a baggie, ziplocked, and then you can put that with the cooler pack in the cooler itself. Now, if you're thinking about, well, what if I'm stranded somewhere, or what if my power goes out, then your unused insulin will be okay in the fridge. You don't have to really worry about that. That'll keep it temperature protected. But your in-use insulin or other medications like GLP-1s, for example, those you could actually put into a travel cooler, and that travel cooler will help keep it at the temperature it's in when you put it in there longer. So in case the temperature drops rapidly and you guys in your home are like wrapped up under blankets and coats and things, if you have your medicines in that cooler, it will help prevent them from getting too cold in an emergency.
How about if excuse me. So are there any myths about winter and diabetes management that you've heard before, like any misconceptions?
I don't know about myths necessarily. I do think I think it's really common that people are shocked when they see how much their blood sugar can move around based on being out in the cold, shoveling snow, getting ice off the sidewalk, taking a warm shower. Any of those things can impact your glucose. So when you kind of combine them all into a condensed amount of time, it's pretty dramatic, the differences in blood sugar values that you might see.
Right.
And I also think, I don't know if I said this or not, so I'm going to say it. If it's again, then it's great because we still need this. This is important information. You can get an inaccurate blood glucose value if you check your blood sugar on very cold fingers. Because if the blood vessels are constricted, then you're not getting good blood circulation to that area of your body. Right. And the sugar is consistently with your blood traveling through your body, right? And you get a fresh supply every time your heart beats. And that is the most accurate blood sugar you're going to be able to get if you're poking your finger to get the test result. And if that is a constricted, cold finger, then you have old blood there. It's no longer an accurate representation, and blood is shunted. So it could read a really false low, which could really scare someone. You know, you check and you have like some really terribly low number. And you'll think, oh my gosh, get your hands to room temperature and recheck it if you don't have low symptoms. And you might be surprised.
Yeah, that's a really good tip. How can people with diabetes adapt maybe their fitness routines for winter without while managing their heart health?
That's a great question. And that is a huge challenge for most people because one of the most common ways that people get regular physical activity is walking outdoors because it's great for our mind, our body, our mental health, our energy levels go up when we get to be out in nature. And if it's like it is outside where I'm at right now, 2 degrees out with negative degrees with the wind chill, we're not outside walking. I don't want to, and I don't want you guys to either. And so walking outdoors during the winter is fine if it's warm enough that you're not at risk for frostbite, right? And you're wearing layers and the path is clear. It's not icy. It's not slick so that you don't increase risk for falling, right? But when it's cold and you can't safely exercise outside, or like me, maybe I just don't want to. If it's even maybe 30 degrees warmer, it's a little hard to motivate myself to be out there when it's cold. You can do lots of physical activities from inside the home, or if you have access to a gym, that's another safe place. Even just walking around inside a local store is an opportunity that doesn't cost anything unless you go shopping, of course. But if you aren't doing regular physical activity at this point in time in your life, then one tip I could offer is, as far as snow removal, is have someone else do it for your own safety. If there's someone who doesn't regularly participate in cardiovascular physical activity multiple times a week and strength training like weightlifting or resistance bands or core body work of some sort, and then you expect to go outside and remove all of that heavy snow, you could physically injure yourself, first of all. But second, you would be at an increased risk just from the fact that this person's life is not very active. It's more of a sedentary lifestyle. So jumping into heavy, wet snow shoveling, that person specifically would be at a very high risk for ending up in the ER from shoveling snow. So just a kind of word of caution to stay safe, and don't feel bad about asking someone else for help for snow shoveling. It's, you got to take care of your health first. That's the important part.
Absolutely. And expanding on that a little bit, how can someone gauge whether they're overexerting themselves during an activity like shoveling?
Oh, yeah, great question. You can think about what you know about your own body when you're at rest, when you're physically active and doing okay, and when you are pushing too hard. So if you at your normal baseline, when you're physically active but not pushing too hard, you can see that you can breathe. You're not short of breath. You're breathing harder than normal. Now, normally you would look for sweat as a sign, but cold temperatures might take that symptom or kind of guideline away. So you're really going to pay attention to your breathing. Is it still easy to breathe, or is it getting kind of hard to breathe? If it's getting hard to breathe, that's too hard. You should slow down and rest. If you're able to monitor your heart rate, if some people monitor their heart rate regularly because they look at that as a guide for their physical activity intensity that they're working on. So you could use a heart tracker, or you can use your hand if you know how to do that. And if you're noting that your heart rate is above what is recommended for your age and your fitness level, then that's another sign. If you feel like your heart is bounding out of your chest, or you're feeling palpitations and you don't normally, that's a time where you absolutely need to sit down. And if you have any other symptoms, like you feel dizzy, you feel any pain in your chest and your shoulders up into your neck, down into your arm, you feel like a pressure in your chest, you feel like you just can't catch your breath, you've rested a minute and it's just not working for you. Or if you're noticing extra weakness in one part of your body, one side or the other, those are all symptoms of a potential emergency, and that would be a 911 call.
Right. So since it's also the holidays, maybe we can pivot a little bit to talking about some topics surrounding that, if
Sure.
that's okay.
Yeah.
So during the holidays, a lot of people consume more alcohol. And how could alcohol consumption during winter gatherings also affect heart and diabetes health? And what precautions could people take?
All right. So there's the what's best for our health side of things. And then there's what people really choose to do, which sometimes don't line up, right? If we're going by, let's talk safety and health guidelines first. It's recommended to not binge drink, which means more than a couple of drinks in one sitting over a short period of time, right? That's always a more healthy strategy for anyone with or without diabetes, because your body can only clear one beverage, one alcoholic drink, about one per every 2 or 3 hours. That's how long it takes your body, your liver especially, to filter the toxins from alcohol out. So if you think, oh, I feel fine at XYZ number of drinks, maybe, but you're putting your body under a lot of pressure and it's doing a lot of work to try to get rid of toxins, which is something to think about, right? But the alcohol itself, if it's straight alcohol, let's say you and your friends and family are doing shots of alcohol, that typically will result in pushing blood sugars lower, especially if someone takes insulin or sulfonylureas, like, for example, glipizide or glimepiride. It can cause low blood sugars to happen. Mm-hmm. And then if the alcohol is mixed with something that makes it taste delicious, maybe you're having some sangrias or some margaritas or who knows, right? Well, those delicious tasting drinks have a ton of carbs. And often people will be shocked that, they went and had they watched their portions very carefully. They selected what they decided to eat out of the smorgasbord of family gathering food. And they had a drink or two that had a sweetened syrup with it. and their glucose can be very elevated,
Right.
like an extra couple of 100 points on top of what's normal for them. So you do have to use caution. And the other trick is, or the other, not trick, the other important thing to know is it could be a temporary elevation. So if someone has one drink, that's not what I'm talking about. If someone has especially more than 2 drinks in, let's say, an evening, since the liver will be busy clearing out the alcohol, once the carb foods all digest and that blood sugar rise goes away, however many more hours your liver is busy clearing out the toxins from the alcohol, if the person takes, especially if the person takes insulin as one of their medicines for diabetes, or a sulfonylurea, again, glimepiride or glipizide, for example, those specific medicines, especially with alcohol, the person will be at risk for severe low blood sugars for the number of hours that the liver is still working on processing out those other drinks. And unfortunately, that typically will be at night. So as a tip, one, try not to overdrink because that puts you at risk. But if you do, then please make sure you have alerts on for your hypoglycemia, to sound loud alerts and maybe wake a family member or a friend. Have a diabetes buddy that can ensure that you wake up to those alerts if you have them. Work with your endo team or your diabetes educators to have a safe alcohol medication adjustment plan, because that's what we do for people who take insulin. We work out a special individualized plan that works for them to reduce risk for low blood sugar in those situations. Yeah.
Those are some great tips. We got a question in the chat. They asked, how do winter foods like stew or big holiday meals impact blood sugar management?
Yeah. You know, I always think about the more delicious it is, the more it's probably going to push blood sugars up, right?
Mm-hmm.
I think stew
Why does
not
it
as,
work like that?
I don't know, man. Stew might be safe because stew typically has vegetables and meat and
Right.
water, which are all like, we can work with those, right? Unless it's just potatoes and a little meat, then that would
Right.
definitely push it up. And so foods that are really filling, there are a couple of things. One, if you eat to the maximum capacity because it's so delicious, you eat more than you normally would, your body will take longer to digest it. So you may see your blood sugars push up higher and stay up forever. Like it'll feel like forever. All I did was eat this and it was delicious. And 6-8 hours later, I'm still seeing these elevated blood sugars. So you definitely need, if you take insulin, a different insulin plan for foods like that. Now, if it's more of things with sauces and gravies, the sweets that come along with the holidays, those types of foods, of course, are going to push blood sugars up much higher and can be very challenging to try to manage diabetes around. So, you know, different people choose different strategies. Some people will do things like try to fill up on salads and low carb veggies and things at the beginning of the meal and drink water so that they have less room for the more delicious, potentially, but higher carb food items. It makes it easier to stick with smaller portions of those. Some people will choose that they try to eat healthy 80-90% of the time. They really do right by their overall health goals, and certain events like family gatherings or certain holidays like their favorite holiday, they may accept that their blood sugar may be a hot mess after that meal, as long as they're doing the best they can with their medication plan with that meal. You know, that's something to talk about with your endo and your diabetes educator team to say, okay, how do I not overstress about this? Because it can be super stressful for somebody with diabetes to try to figure out how to measure, how to count, how to ask family members what the heck's in that delicious looking thing. And it can be overwhelming, and it makes people sometimes feel like they don't want to go and hang out with family and friends. And that's not going to pay out in the long run for your health either. So it's really about finding that balance and what makes the most sense for your health and staying safe. You know, we're not aiming for perfect during the holidays. We're just safe is really what we're trying to do. And thinking about, just like anything else with your diabetes management, what you do now will have an impact over the next few hours, but also potentially over the next couple of days or weeks, depending on how much you like to eat at holidays. Because you can gain several pounds over the holidays just by eating more delicious foods that are available, and everybody wants to feed you when you see them,
Right.
and having less access to physical activity because of the weather. So it's a really challenging time for most people to stay as healthy as possible during this time of year. So,
Right.
yeah.
Yeah, and that's a good point that you raised about, if you're trying to avoid the health implications of going to these gatherings where there's all this food, but then also you're kind of neglecting your emotional and mental health by staying away from these situations with your loved ones. So that makes me want to ask about, because the holidays can just generally be a stressful time for a lot of people.
Yeah.
And so do you have any input about how to manage stress, or what that impact is on different blood sugar levels or other aspects of diabetes management?
Sure. Yeah. And, everyone has a family, right? Some people have tiny families, some have extensive, large, overwhelmingly huge families, right? Some people have very quiet, reserved interactions with their families, and some families, if someone from a reserved style family walked into their family gathering, it would look like there was a fight breaking out because there's yelling and jesting, and it's just so loud, right? So you have to fit your personality into the family dynamic the best way you can without making it overwhelming or stressful for yourself. So I think it's important to just take stock and say, okay, when I go to these family gatherings, what always pushes my buttons, and what am I going to do about it this time? Am I going to sit down next to the people that really always push my buttons? Or could I maybe go visit with this aunt and uncle that I don't spend much time with? Maybe that would be less stress on me. Or what could I say when people start pressing me, especially about diabetes? Like, should you eat that? And how is your diabetes doing? Or let's comment on your weight while you're here because we're family and we think we can do that, right? If you think about it ahead of time and prepare, you can come up with some good one-liners. Some people will choose to say things like, oh, thanks for taking an interest in my health, but I'd rather talk about you. What's going on in your world? And just change it. And other people would take time to educate. They might say to the diabetes police, like, oh, should you be eating that? My favorite response is, oh, should you be eating that?
Right.
And then they look at you funny and be like, well, it's kind of the same question because whose health is unimportant? None of ours, right? Yeah. Or you can be more polite and say, oh, actually, I worked with my endo team and my diabetes educators, or my PCP and my diabetes educators, and we came up with a strategy for this meal. So I'm staying within my health goals, and that will make an impact on my blood sugars after this meal. Thanks for asking. Yeah. So there are different ways. Some people are, bolder than others. And some people like to employ sarcasm in how they interact with people that push their buttons. And some people are much more polite and would focus maybe more on the education. And you don't have to do the same thing every time. So let's say you had a plan, but you get there and you've got a migraine. Forget educating everybody else and saving the world, right? Like, find your comfort, find the de-stress places, and always give yourself an out. You can always say nothing, which is also a fine response when somebody's really over the top. You can say nothing. You can pretend you didn't hear it and turn and talk to somebody else. There are all kinds of things you can do in those, like, you sort of feel trapped, stressed out moments that can happen. And the stress is going to raise blood sugar. So here you go, like, I'm going, I want to go enjoy this. And now somebody pushes your buttons and you get hot and mad. Now your blood sugar is going to go up. And your blood pressure too. Yeah.
Right. Yeah. Those are good tips. It's interesting to me that people feel emboldened to ask why you're eating something, as if you don't live day in, day out managing your diabetes and what works for you. So
right. And really, honestly, it could be that you want this particular food and you've made a choice to eat it, And that is your personal choice. And it may not be the best choice. It might not be the most healthy thing you've eaten all year, but it's still up to you to do that. It's no one's business. No one's, that's one of my biggest, you can tell it like pushes my buttons, right? I get all angry. I like talk with my everything. Like, ask me that again. See what you get.
Right.
I've lived with it for a long time. I can't even tell you the hundreds of people in my lifespan that have asked me if I should be eating that, or is that good for me, or doesn't that seem like a lot of carbs? Like, ugh. Yeah.
Do you have your go-to response to those questions, or does it really just
it
depend on the mood?
It depends on the person too. If it's somebody I'm going to interact with a lot, then I try to be more appropriate.
Yeah.
If I'm in the group setting, I'm probably not going to see these people again for like 6 months. Then I'm going to be more short with my answer. And that would be where I'd be like, oh, are you supposed to be eating that? Because then it shut it down. If it's somebody, for example, when I worked in an office and a coworker would ask, typically most people are asking because they have concern for your health and they want you to be healthy. Most people aren't asking because they want to criticize you. Now, there are some family members that will look for the thing, right? So you know them. And those are the ones that I would respond differently to than someone who genuinely wants to understand what my life is like. So, we ask people all kinds of things like, oh, how's it going with that new fence you're building? Or how's your new job going? And so it's just something visible in front of them so they can ask, well, you have diabetes, so they might as well ask about diabetes because you can talk about it.
Right.
So keep that in mind. Sometimes it helps not to let that button get pushed instantly.
Right.
If you think behind the scenes are trying to help you. And so that's somebody that I would take the time to say, oh, I'm glad you asked. I actually have thought about this, and you'll notice that in this case, half of my plate is already filled with vegetables. And I took just a portion of this meat. And instead of getting this, and this, I took this and this. And that way I'm not going wildly over what I typically eat at a meal. Maybe it's more, right? I might be eating more than normal. And I'm going to adjust my insulin to it because I've been trained on how to do that. So I can eat this meal relatively safely. And I know what to hopefully expect. And if it doesn't go the way I want, I have the education and training to adjust either my insulin or treat a low if it happens, if my glucose doesn't land where I'm intending for it to land. Thanks for asking.
Right.
And so if they're really interested, they're going to hang on and listen to that whole thing, and then they'll have more questions. Yeah. If they were just like nonchalantly, they aren't going to ask me any more questions about my diabetes ever.
Right. I like the way that you reframed that, giving people more benefit of the doubt than having like a criticizing intent behind it. Especially the point where it's like, it's something to talk about. It's just happening right there. So.
And it's human nature. I don't know what it is, but we all feel like we should just jump in there and tell people stories, right? Like, people do it to pregnant women all the time too. Oh, you're pregnant and you have diabetes? Let me tell you a horror story. Great. Thank you. That's perfect. I was hoping somebody would say that to me today, right? They do the same thing with food, and they do the same thing with diabetes. But we do that forever. If you'll catch yourself doing it now that we're talking about it, you'll think about an interaction with somebody who tells you a story about their health, and then you want to relate to it. So then you go, oh, I know somebody who, and you tell them the story. It's the same.
Yeah.
It happens a lot.
Right.
Yeah. So yeah, most of the time people are just trying to understand and connect. They aren't trying to say they get what it's like in your shoes.
Right.
Most of the time. I can't say all the time, right? Because there are just some people that are looking for a fight all the time. Yeah.
But those are some great tips for how to handle the unwarranted questions that come up over mealtime at the holidays.
And I didn't come up with them myself, right? These are things I've learned over time and heard lots of people talk about, and I pick up new tips all the time because, like, for example, saying nothing and turning away. Oh my gosh, that's amazing.
Works like a charm.
I think of that? I mean, what are you going to do? Are they going to repeat the question if it was obnoxious? Probably not.
Right. That's a good one.
Yeah.
So we got a question in the chat. Someone said, I eat peanut butter to bring down my sugar spikes. Are there any other foods or drinks that will help to bring down the spikes?
Yeah. All right. So it could be that this person is talking about, I'm just guessing since it's a comment, I can't ask more questions of them. If someone incorporates protein and fat, or protein or fat or fiber into a carby situation, it can help slow down the digestion of those carbs, and you may see less of a spike after eating that carby food. So peanut butter is a great example of that. If you imagine eating a piece of bread and then bread with peanut butter, what you'd see on a CGM curve, or if you did a before and after blood sugar check, you would typically see a smaller rise, and it may be slower and longer with the slower digestion of the protein and fat, but it can help this from not happen to the blood sugar when you eat something and digest quick. If your glucose is elevated, then water is your best friend, because you're going to be dehydrated. Your body is already working to make more urine so that you can pee out extra sugar. That's its only escape route through the body without extra medication. If you have been guided on how to take, for example, extra insulin appropriately for that. But if somebody doesn't have insulin as a prescription or hasn't been taught how to use that safely, then your best choice is water, a lot of water. And then it will come down slowly on its own over time. And then walking, if your glucose is not severely elevated. If your glucose is really elevated, you should have a safety threshold with your doctor's office that manages your diabetes medications and supplies, that if your glucose is over a certain level, we want you to call us because something's wrong and we may need to do something different than normal. So I'm not talking about that elevated. I'm just talking, you ate a family gathering kind of meal that was like what someone else was talking about, the delicious foods, right? And now you're sitting there and your blood sugar is elevated. What are you going to do about it? Going for a walk, drinking water, and avoiding adding more insult to injury to those blood sugars for a time, to give your body a chance to, and the medicines you take to get that back down again is your best plan.
Right. So as we're wrapping up our discussion today, looking ahead, what are some long-term habits that people can build during the winter that can improve their diabetes and heart health year round? Like, what are some tactics that people can just continue to incorporate on a year-round basis, perhaps?
It's a good thing to think about, because typically people will start thinking about new goals for the new year, right? And typically people will start to sort of fall off the wagon of what they were working on by about November, definitely in December. A lot of it's to do with the weather, but also just the time of the year. There's so much food, and there's a wide variety of religions that all involve food during these months. And so thinking about your health goals is sort of the primary piece. What are you interested in doing? What are you willing to do? And what could you try differently this year compared to last year if you didn't like how things started off in the new year last year? Right. So if you go back to your New Year's starting over plan for this year, the year before, what are you typically focused on? And could you start on that now? And then it won't be such a big swing from where you are to where you need to be.
Right.
You always take steps now, even if you can't, it's too busy, there's too much going on, there's too much stress. What can you do for your own health? Even if it's just de-stressing and getting some relaxation in, or even if it's getting to walk for 3 minutes a day or 5 minutes a day, it's still better than not walking at all. It's still worth it.
Right.
And thinking about what choices you do have with your food, whether it's going to the store and picking healthier options to snack on, or it is you're going to a food pantry to get your choices, then your choices are more limited. What can you do with the food that you have? And maybe there aren't a lot of choices. Maybe some food pantries let you pick some of the items. So could you pick 2 of those and none of those?
Right.
But if you just get the box, that's what you have to work with. And you can work on physical activity and stress reduction, getting good sleep, reducing or stopping smoking. Those are all things you can do for improving your health and maintaining your health at any time, really.
Right. And that's a really good point, because I think a lot of people just want to go from 0 to 100 on January 1st, and then that ends up not being sustainable and they burn out quick. So I think that
Absolutely.
it's a good tip to maybe start now, especially when the challenge might be harder with the holidays and all of the responsibilities and the food and everything like that, and how it's cold outside. It's not as easy to get the exercise, to start incorporating some of those things that you want to accomplish in 2025 now in smaller ways, and work up to it by January.
Yeah.
That's a really
We're all
good
sort of creatures of habit. So if we just
Mhm.
gradually change our habitat, it's much more comfortable. It's much less distressing.
Right.
You change things on
Absolutely.
me quickly. I'm not so eager to like leap into action either. It's just our human nature for most people anyway. Yeah.
Yeah, absolutely. Um, Are there any additional resources or tools that people can use to stay informed about winter health and diabetes management? Or how could people stay in touch with you or integrated diabetes services? How might you all help with
Yeah.
management in the winter time?
Yeah, in general, the American Diabetes Association has some pretty good information, really good information for people with different types of diabetes about living healthy, including living healthy in the wintertime. So that's a good, you can Google search American Diabetes Association and find their website full of lots of education for free, which is great. And then as far as finding me later, if you wanted to set up an appointment or learn more about integrated diabetes services, you can look at our website. It's integrateddiabetes.com, so that's easy. And then on our website, there's an About Us button. If you click on that, you'll see each of our staff members and our background, like registered nurses, registered dietitians, exercise physiologists, licensed social workers. You can find what each of our team members is sort of focused on, or our background information. And there's a Contact Us button on just about every page of our webpage. So that's the best way to find us. Yeah.
Awesome. So thank you so much for joining me today, Tavia. Do you have any closing thoughts as we wrap up about our topic today?
I was thinking about how happy I was that we shifted gears a little, because in the beginning it was like gloom and doom, like be careful
Yeah.
about shoveling, it's very dangerous, like kind
Yeah.
of pushing hard there. But just the idea is, I feel like informed decisions are important. If you have the right information, then you can decide what's best for your own health and be wise with the decisions you make. It's always the worst, I think, when something sort of happens to somebody and they had no forewarning that there was even something to consider. So knowing that heart health and blood sugar health can be really impacted by cold weather, and knowing what we know about diabetes and heart health anyway, anything that you can do to help do what promotes your health and well-being is very important during this time of year, so that you can get out there and shovel the snow and visit with your family and enjoy your time. So hopefully today we talked through several things that are topics that are relevant to what you're either dealing with right now or you're about to, so that you can take really excellent care of your heart health and your blood sugar health during this cold season. I think it's not cold in a couple of pockets in the US right now, I've heard.
Right.
But
Right.
there's a lot of cold right now, so you're not alone if you're wondering
Right.
how much colder it's going to get. Yeah.
And just a fun little question before we go. Do you have any fun plans coming up, Tavia, before the end of the year? Maybe celebrating the holidays or?
I don't have anything really exciting planned. I do have a couple of days off where I do get to spend some time with my family, which is nice. And we typically stick close to home because the winter weather is so unpredictable where I'm at, that we don't usually go traveling. I was tempted. I thought about it, but we're probably going to stay here and play games, and yeah. Yeah. Which
Nice.
is okay. Less stress. I'm
Yeah.
all about less stress.
Mm-hmm. I feel that.
Yeah. What about you?
I'm gonna go visit my family for Christmas, my parents and my 3 little siblings, and my grandparents as well. We all get together. I'm one of those people from a smaller family, so it's not quite as overwhelming for me to get together
Yeah,
with them for the
that's nice.
holidays.
Yeah.
But yeah, we'll just have a cutesy little Christmas at home, and I'm looking forward to that. I was supposed to go to New York City with my sister and her husband next week to see the tree and just do some like Christmassy things. But the weather forecast is looking really bad. It's supposed to be
Yes.
very, very rainy, so we might have to
Let's
shift
see.
gears.
Yeah.
But we'll see. Um, all right, so before we go, I just have to state again that nothing stated today is intended to be a substitute for professional medical advice, diagnosis, or treatment. Our discussion is for informational purposes only. Always seek advice from your healthcare provider for any specific medical conditions. And if you don't already follow us on Instagram, please do. We're posting a lot of great content under our theme for December of winter wellness. So you can give us a follow at Byram Diabetes Care. And thank you so much for joining today. Thank you, Tavia.
Thank you.